Things that comes to mind is that we have an obligation to kind of remember. Maybe one of the most common things I hear is, well, I was able to quit drinking, or I was able to stop taking those pills. Why can't you just do that? And the simplest answer is probably because you didn't have the disease. There's many folks who use or even abuse drugs and alcohol at different periods in their life and they're able to stop. But for someone who actually has the brain disease of addiction, just simply putting it down and walking away typically isn't an option without an intervention. So we need to make sure those interventions are available.
There's never been a time when someone hasn't been so adamant about something that they didn't have alcoholism in their family, addiction in their family, and it's more personal. So our thoughts might not be rational, they're personal, they're emotional. And it's just reaching them on an intellectual level that becomes very difficult because they're hurt in their heart. And that's where you have to meet them. Where is their hurt lying? Where is their anger lying?
If you're experiencing a crisis or somebody that is experiencing a crisis in your family, you can't bullshit yourself. You can't say, listen, this doesn't exist. You can't hope it away. You can't wish it away. You can only do some proactive steps if you say, listen, we got a problem and we need some help. And there's nothing wrong with saying that you need help.
It's easy to sit behind a screen and type all this hate and spread that stigma because it's easy to kind of get sucked into that mob mentality. Whereas if we spend some time talking with people and building those relationships, that stigma tends to fade and we see the good in people.
I think it's really important to make sure that you have that mind-body connection. And by that I mean first responders and medical professionals especially really know that stress can cause physical problems. But I think it's really important that we know how stress is affecting us in the moment. And the only way to do that is to practice and know how your body feels in a time of stress versus how your body feels in a time of relaxation, so that you can kind of, in the moment, realize that.
The best thing you can do is be a good example. It's so easy for us to point the finger at addiction and addicts and say they're doing all these wrong things, and we are just as guilty of not taking care of ourselves. It's just the destruction and the consequences of that are not as huge or as visible or as apparent. But there are lots of people who are very unhappy with their lives and have sort of made a mess of their finances and their relationships that have nothing to do with drugs. They have to do with an inability to care for themselves.
As caregivers, frequently we're super at putting everybody else on our priority list first, and we're lucky if we make the list at the bottom. We don't tend to fix something if we don't think it's broke. We got to recognize that that's what's going on. Or if it's not going on, to take some protective measures that, hey, this is a real thing that can really affect me and others around me. So I need to make sure I take some good care of myself. Here's how some of those things to dig out on.
It puts us on the path to wanting to solve problems with individuals and their behavior rather than just punishing people for what they do. There's a great quote from one of the Common Pleas Court judges who I respect very much. It says, I don't punish the person, I punish the behavior. And I think that that's good, but I think now we're moving towards, I don't want to punish the behavior, I want to solve what causes the behavior so it doesn't correct itself again.
It's always about priority. Say to yourself, say out loud, I am not a priority, and see how that feels. That's exactly what you're doing. Every time that you put in the extra hours when you're tired, or when you pick up the slack for somebody else because somebody has to. I don't think that that's helpful to anybody. Even though we all feel like we're being helpful and useful and it's got to get done, I don't think that's true.
We have to really kind of put ourselves a little higher on that priority list in terms of our self-care. Getting around those folks who care about us and love us and just allowing them to do that. Especially as first responders, allowing other folks to care for us, even though it may feel alien. Because usually, hey, I'm the person supposed to be giving the care. What does it mean about me if I have to receive it? It just means that we're human.
For many people, addiction hasn't affected me personally, or maybe I haven't seen it affect a loved one. So they think it's not their problem. But truthfully, if we're going to solve the problem of addiction in our community, we all have to take that responsibility that addiction starts with prevention. In order to do that, we have to create a community that is nurturing for all of our children.
You really want to put your energy into those in the preparation stage, and that's what we do. But they call us on the phone and they say, I'd like to engage in treatment, I want to treat my disease. So they're in the preparation stage of change. They're open to new information, they're open to working, they're open to learning how to manage their disease. And that's really what our focus is. We don't talk to them about addiction when they come in. We talk to them about their chronic disease that they're going to have to manage for a lifetime. So we're saying you won't recover from the disease, you can manage the disease, whether that be with medication, without medication. It's a lifetime of management, but you can recover your life, all those things that you lost while you were in your chronic disease state and addiction.
I really believe in individualized treatment, but I also, kind of have some limitations on that. Oftentimes when I talk about different paths, some people may incorporate in yoga, some people may incorporate in different forms of meditation, some people may choose that exercise or nutrition and some of these other components are critical aspects of their program. Some people may follow SMART recovery, but I typically encourage some form of abstinence-based programming because
Getting involved is such a huge part of creating a culture of recovery. Becoming involved, meeting people who are in recovery and who have used the evidence-based practices that are in place to heal and spreading the word about that. I think it's important if we're going to address stigma, we need to have a voice. We need to explain to people that there are services in our county, that we have services available, that there are people here that want to help, that can help, that we are unique in this county and that we are learning to work together and have a shared language and have this collaboration between different areas of the recovery process. So working together has been instrumental in seeing some of those changes.
that's where I've seen the most success.
Support groups and being around individuals who have gone through or are going through exactly as you, that you're not alone. The disease of addiction becomes so isolating and you feel like you're the only one in the world. And to see that, number one, that families recover, that individuals recover, but there's something so therapeutic about being around. And it's like that for any disease. There's support groups for Lou Gehrig's disease, there's support groups for cancer. It's what brings us hope and brings us serenity and peace.
Getting around those folks, getting that compassion filled back out, being around people we care about, doing things that we really enjoy and love, being able to do physical kinds of things, whether it's the gym or walking or what have you, that's a marvelous antidote for that, as well as taking care of our emotional and spiritual needs too.
We all need to recognize that we are a priority, and taking care of ourselves should always be a priority.
The first place is finding somewhere where you can relate and identify with others, and just knowing that you're not alone and that you no longer have to do this.
We have to change the paradigm of how people look at this disease. If they look at it as a chronic disease, there are predictable outcomes and chronic diseases are treatable. We never look at diabetes and say, oh, you're hopeless. We say, okay, the doctor will give you medication, you could diet and exercise, and you'll be fine. You'll have a nice long life. And it's the same with addiction. If you treat it like a chronic disease that it is and you manage it for your lifetime, that's hopeful.
Research has clearly demonstrated, no matter what path you follow, that ongoing wraparound support from family, friends, and the community really dictates whether or not people are successful. We can't do this alone. Just like you don't battle cancer alone, you don't battle, addiction alone.
I think that we're making some positive steps. The community is making some positive steps. I think a lot of good and smart people throughout the community realize that this is a problem. A lot of people have made it a point to try and be a solution to the problem, whether it's just telling their community leaders, hey, listen, we need you to do something, whether it is supporting levies that would provide more monies to these organizations, or whether it's attending awareness events.
Sending the message that Narcan is life-saving and recovery is possible. Every one of us, whether we work in a factory or when we go to church, we have an opportunity potentially to save a life.
Sure, it's very helpful to get out there, and I do lots of speaking engagements and education about the disease of addiction because I have that knowledge and other people don't. It's important for me to take what I have and share it. And I think anybody with specialized knowledge or training to share that with everyone so that we all can benefit from that knowledge or training. That's everybody's role. Everybody in life, that's our role. If we have special knowledge or training, share that. Use it for the good of everyone.
We can all identify on an emotional level. So, I can talk to my significant other and say, I saw somebody really make a bad decision today and it made me sad. Or I can say, I saw somebody succeed and, they came back a year later with sobriety and I just felt so good to see that miracle. And so part of that is sharing on the emotional level. The other part is that we can actually talk to our supervisors and folks in a leadership role have an additional responsibility to model that behavior, to ensure that they're working on their own emotional intelligence so that they're open and there's a culture of openness where we use feeling words. We really need our leaders to be trained in that area and to be guided through that so that they can allow the people that they supervise to do that as well.
But it takes practice. You have to really take time. It doesn't have to be a lot of time, but you really do have to take that time for yourself and regularly practice making that mind-body connection so that you can acknowledge when you're feeling stressed before it gets too late, so that you don't have a huge hole to dig out of. Maybe you just have a little pothole.
If I'm spending all of my time really taking care of myself and doing the right things, not only is my global health apparent to people around me, but the actions that I'm taking every day without almost thinking are evident to other people. And they're saying, what are you doing? What's going on with you? And I'm saying, oh, I got this great eating plan, or this is how I'm taking care of my physical health. You have that small piece, and that ripples out. And the idea is if you can influence enough people, then their ripples will go out.
I recently asked one of our staff members whose drug of choice was heroin, when you bought your heroin, where did you shoot it? And he said, the first available public setting. And it didn't matter if it was a McDonald's or a Starbucks or a library or a church. Everywhere there's a public bathroom, we should have the availability that would save a life, because we never know. So I advocate everyone to have Narcan available, regardless of whether it's only in your family. And maybe if we all agreed to have Narcan, some of the stigma would go away, because it doesn't matter. We're just trying to be good citizens and save the life.
So when they understand it in that way, they actually feel a little bit of relief, because they're the ones that are trying to run around and manage the disease. You need to go here. And we just hand the disease to the patient, say, this is your disease. You ended up here abusing, or you put on pain medication. It doesn't matter how you crossed the line and got to chronic disease. Now you have to manage the chronic disease, but that is the sole responsibility of you, not your family. It's your disease and you're going to have it for a lifetime. So that's a different conversation, and it's a relief more for the parents, but it's also an accountability for the patient.
Be honest about what you think and feel. Be open to suggestions, feedback, reaching out, and then be willing to take those suggestions. Be willing to listen for answers and reach outside of yourself. If we apply that to ourselves in our daily life, then it opens us up to endless possibilities and endless power. Because regardless of who we are or what we know or our life experiences, us combined as a community, we're much more powerful than just ourselves.
We need to nurture those environments for them so that they don't take the risks that might lead to addiction.
I don't think there is anything that speaks louder or that creates a bigger ripple in a community than being a good example.
People are really banding together to try and fix this. The only other thing I would say is be a foster parent.
I think another key component is celebration. We have to celebrate the successes and recognize the successes to overcome our human tendency to get drawn into the negativity.
Let's be honest about our own perceptions or misbeliefs or concerns. Let's share about them. Let's be open to learning, and let's be willing to change our minds as we begin to see the science and the testimony and all of the examples that we do recover. We do recover.
If we all take our own advice and we all operate on this idea that we are a priority, taking care of ourselves is important, we can all get better, is a good place to start.
Realistically, it's not going to be a wonderful, serene path all the way. Life isn't like that, let alone the chaos and upheaval that addiction brings. Recognize that we're going to have some good times, sad times, happy times. Savor all of the above, knowing that that's kind of part of the journey.